Hello and welcome to Pharmacology News Review here at the 4th Midkine Symposium in Budapest in April 2016. On this show, I have Professor Peter Ferdinandy, who is the professor at Semmelweis University and Pharmahungary, based here in Budapest. Welcome.
Yes.
It's good to see you. Because your activity is in Midkine, and particularly you're interested in the area of cardiac muscle injury in ischemic heart disease. Could you, first of all, could you describe your current research program?
Yes. Okay. So first of all, I run a biotech company which provides services, especially in cardiovascular diseases, focusing on myocardial infarction and heart failure. And I've met with Cellmid professionals 8 years ago, and we engaged into a common development of Midkine therapeutics against myocardial infarction and post-ischemic heart failure. Myocardial infarction is still treatment of myocardial infarction is still an unmet clinical need, since there are no drugs on the market so far which could decrease the size of the myocardial infarction, and therefore companies are seeking for efficient and safe treatment which could, by addition at the time of the acute myocardial infarction, are capable of reducing the volume of the dead tissue. That means the area of the infarct, so the size of the infarct, and this is what we are looking for. And we have done a lot of research in rodents to test different formulations and different treatment schedules of Midkine, and we found that it's very efficient in cytoprotection and also in protecting the cells, myocardial cells, from ischemia and reperfusion injury. And also we have found that Midkine is able to reduce infarct size, and therefore it's worth for further development in this line.
Right, fascinating. So what is the have you got close to the mechanism of action? Because obviously you're making these, you see these observations with Midkine. Yeah. So what's the relationship? What's the direct relationship with Midkine in this particular context?
Yes, Midkine has probably multiple targets. Yeah. One plausible explanation is the profound anti-apoptotic and anti-necrotic effect of Midkine, and therefore it protects the ischemic reperfusion injury, which basically ends up in apoptosis and necrosis. And Midkine is able to prevent or protect the cells against it. There is also another effect of Midkine which promotes neovascularization, and by this neovascularization the effects of post-ischemic injury can be alleviated, since the blood supply of the injured myocardium can be improved.
Right, indeed. So, I mean, obviously, when these events occur, they are life-threatening conditions. So if you're looking at it from a clinical therapeutic point of view, how would you see the actual treatment actually rolling out?
Yes, in our head, of course, the clinical development is already in the plan, in the pipeline, and the treatment how Midkine protein can be applied is limited to acute and subacute treatment, and during the current state-of-the-art treatment of the myocardial infarction, which is balloon angioplasty. So that meaning that when the patient has an acute heart attack, myocardial infarction, then it gets to the coronary unit, where the occluded coronary vessel will be reopened by a balloon catheter. Okay. And as soon as with this balloon catheter the coronary artery will be opened, a local treatment with Midkine is plausible at the time of the reperfusion, and therefore a sufficient dose of Midkine can be delivered at the ischemic zone of the myocardium, and therefore it can protect the myocardium. And another potential application of Midkine is basically it's a long-term inhibition of Midkine could be on the stent, which is placed into the stenotic artery, because in the long term effect of Midkine could be proliferation of the cells, and if we inhibit that with, for example, a silencing RNA or an antibody coated stent, we could in the long run prevent the coronary artery from restenosis in the stent. So it has it's a very interesting therapeutics, because on the one hand we could use the protein itself as a cardioprotective agent and the local inhibition of Midkine as a anti-proliferative agent.
Yeah, very, very interesting. I mean, I suppose interesting that Midkine has so many different roles. And at a particular conference like this or a symposium, you hear about all of that. But I suppose in the context of what you're talking about, in the area of cardiac muscle injury, effectively, how do you see that actual, right down to the molecular level? What's actually happening? What is Midkine doing? And also, just a little bit on that also, is that we talk a lot about its modulating effect. So the very fact that it's a modulator rather than a binary has a binary effect may be one of the reasons why it's such an effective potential therapeutic. Yeah,
basically the clear intercellular signaling pathway of Midkine is not completely known.
Yeah.
However, we suspect that some of the so-called cell survival kinase pathways are activated. One is the phospho-AKT pathway, which could be involved, and of course some other research is needed to check the well-known other cytoprotective pathways like the SAFE pathway or the nitric oxide cyclic GMP protein kinase G pathway. So far what we know is one pathway is effectively activated by Midkine, one of these so-called survival pathways.
Peter, thank you very much indeed for coming on the show.
Thank you very much.